Do you have sacroiliac joint pain? Well, if you do, you likely know it, though maybe you aren't familiar with the name. It's a specific type of lower back pain. Here with treatment options, we welcome Dr. Amit Patel from OSS Health. Sacroiliac joint. What is that joint? How does it relate to back pain?
Well, Ms. Kim, thanks for having me again.
You're welcome.
So when we talk about low back pain, there's a lot of etiologies or causes of low back. They can have degenerative disc disease, you can have hip problems, you can have sciatica. The SI joint or the sacroiliac joint is another common, often misdiagnosed or overlooked diagnosis that can cause low back pain. And the question really is, what is the SI joint? And the SI joint is a transitional point between the lumbar spine and the low back to the pelvis and the lower extremities. And so that at that transition point, you can have a fair amount of stress, and that stress can relate to or transfer pain.
So then who typically gets this sort of discomfort?
So anyone's at risk for SI pain. If you look at the population of patients that have low back pain, up to 20% will have SI-related pain. That being said, my most common population is either folks who had prior surgery, who had a trauma to the SI joint, or even more commonly is a patient who had pregnancy-related back pain that didn't improve after the birth of the child.
Oh, isn't that interesting? So what are the symptoms like that maybe somebody can identify that maybe this is what it is?
So the four most common symptoms that I see, number one, patients will complain of sciatica-type symptoms, pain going down the leg. Number two, pain in the groin area. And number three and number four, the most common, patients will complain of pain in the low back area below the belt line, usually one side. And fourth, the patients will find that they're either standing away from that side, so difficulty bearing weight to that extremity, or they'll sit in a very crooked or awkward position to take that pressure off the SI joint.
Yeah. So, so once somebody has the diagnosis, good news, there are treatment options. Let's talk about that.
There are treatment options. The dilemma with the SI joint is not so much the treatment options as is the diagnosis itself. And once that diagnosis is made via a battery of tests, physical exam findings, and injections, you have a lot of options, very successful options that are non-operative. And that includes steroid injections, physical therapy, bracing, medications, chiropractic manipulations. If and when those non-operative measures were to fail, there are surgical options and minimally invasive surgical options that can be utilized to address the pain.
And that's where this comes in, right?
And that's where this comes in. This is a minimally invasive implant that can be inserted in a very, very small incision to help stabilize an arthritic or irritated or inflamed joint.
That's so interesting. It's so small, and this makes such a difference.
It makes a huge difference. When we talk about surgical options, typically the traditional option was an open surgical option. But the downside of open surgery is, well, it's an open procedure. So it's a bigger dissection, more blood loss, higher rate of infection. With the minimally invasive option, the benefits are really related to the surgical approach itself. It's less invasive. There's a less dissection. Infection rates are lower. Pain is less, and the return of function is quicker. And so you get these similar or better outcomes in terms of the fixation with a minimally invasive approach.
That's terrific, because I think so many folks fear the surgery. You're like, oh, I don't want the surgery. But this is saying, you know, it could really, really help you, and it might not be as bad as you think it's going to be.
Correct. The recovery is not very long. It's an outpatient-type procedure, unlike the open procedures, which are the recovery can be months and months and months.
Well, terrific. You offered a lot of hope to folks battling that, consistent chronic pain. Thank you so much, Dr. Patel.